Hi, my name is Mark Adlen. I'm the medical director here at Water's Edge Recovery. I have been in practice, private practice for 42 years. I've always dealt with addiction. I became certified in addiction medicine in 2010 after a long experience treating two addicts at home, my boys. I could state with a good deal of confidence that this is a great program, having had experience in other programs. The thing that makes Water's Edge Rehab unique is the way that they care about the patient and the level of treatment, the therapy that they get. There are many places that just engage these patients in 12-step meetings all day long and they do nothing else. This is an entirely different program. It's more than that. There's individual therapy sessions, there's group therapy sessions, there are meetings on the outside, not just inpatient. This covers about all the dimensions that are necessary to help one recover from the disease of addiction. A couple of years ago, I had my oldest son come to Water's Edge Recovery. He had been clean for 11 years when he relapsed, and of course, as a parent, this is a horrible thing, having a child go through this. You feel completely powerless and you just don't know what to do. There's a thing called codependency, where you're trying to have a relationship with somebody who is incapable of having a normal relationship, and that's what I was doing. When I came to realize what the program was like at Water's Edge, I decided that this was a good place to send my son. He successfully completed the program here, and he's doing very well now, thank God. Every parent's fear is that they're going to lose their child to addiction, and that is something that could easily happen. The way I like an addiction, it's almost like demonic possession. Something takes over your body and mind, makes you into a different person, makes you do things that normally you wouldn't do or consider doing. It's a very, very powerful entity. They address all aspects of this entity, this horrible thing, at Water's Edge, and treat it so that it is unlikely that it will rear its ugly head again if everything that they tell you to do is done. My role here is that of medical director. I had no intentions of being medical director here. I kind of stumbled into it. When my son was here, they knew that I was certified in addiction medicine. When they were stuck between physicians, they asked me if I would be willing to fly down and to lend a hand. And naturally I said, yes, I would. And I came down here and I started seeing patients. That happened again the following month and the month after that, and then I was approached by the administration and asked if I would like to work here. And I decided that I got a lot of satisfaction out of helping people, and there's no better way to help somebody than to help them through the disease of addiction. And I decided that I was going to make this my life path at this point. What sold me on this place, again, is the individualized care, the compassion of the therapists, and the general program, which is unlike any other place that I've been, and I have been to other places. At Water's Edge, we try and treat everybody as a person, as an individual. Okay, there is no cookie-cutter therapy. Everyone is given a history and physical and an individualized plan of treatment. Again, some places just put you through 12-step meetings and that's it. And if you do well, great. If you don't, that's just your fault. That's not the case here. There is individualized care. The entire staff cares about the patient to the point where we feel like they're our own children. And I think that's one of the things that makes Water's Edge different from the other centers.